How is a hidden PFO stroke cause discovered by echocardiogram? Imagine trying to find a tiny leak in a pipe that only opens sometimes. That's similar to how doctors find a hidden patent foramen ovale, or PFO, which can cause strokes. A PFO is a small flap-like opening between the right and left chambers of the heart that usually closes after birth. But in about 1 in 3 adults, it stays open just enough to be a problem. This opening can let blood clots or bubbles bypass the lungs, which normally filter out these particles and travel directly to the brain. When this happens, it can cause a stroke, especially if no other clear cause is found. These strokes are called cryptogenic because their source isn't obvious without detailed testing. A PFO often doesn't cause symptoms and can't be detected during a regular physical exam or with simple tests like chest X-rays. Standard electrocardiograms or routine echocardiograms without contrast usually miss small or intermittent shunts. That's why specialized echocardiographic techniques are needed. The most accurate method is a transesophageal echocardiogram, or T, combined with a bubble study. During this test, a thin tube with an ultrasound probe is gently passed down the esophagus, which is right behind the heart. This close proximity allows for clearer images of the heart's atrial septum, where the PFO is located. In a bubble study, a small amount of agitated saline, which contains tiny microbubbles, is injected into a vein in the arm. As the bubbles travel through the bloodstream, they reach the right atrium of the heart. If a PFO is present and open, these bubbles can pass through the opening into the left atrium. The doctor watches 4 bubbles appearing in the left atrium within 3 heartbeats after they show up on the right side. To make sure the shunt is active, the patient is asked to perform maneuvers like the Valsalva, which involves holding their breath and bearing down as if trying to lift something heavy. This increases pressure in the right atrium and encourages the PFO to open temporarily, revealing any hidden shunt. Sometimes, a transthoracic echocardiogram, or TT, with a bubble study is used first because it's less invasive. However, its sensitivity is lower, especially for small or intermittent shunts. That's why T with bubble study is considered the gold standard. It provides a detailed view of the atrial septum and can detect even tiny openings. Color Doppler imaging can also be used to visualize blood flow across the septum, but it's less sensitive than the bubble test. Detecting a PFO is especially important in patients who have had a stroke with no obvious cause, particularly if they are young or lack traditional risk factors. Confirming the presence of a PFO can influence treatment options, such as closing the opening or using blood thinners, to reduce the risk of future strokes. It's important to remember that not all PFOs cause problems, and the decision to treat depends on individual risk factors and medical history. In summary, discovering a hidden PFO as a stroke cause involves a specialized echocardiogram called transesophageal echocardiography with a bubble study. This test involves injecting microbubbles into a vein and watching for their passage from the right to the left atrium, especially during maneuvers that increase right atrial pressure. This method provides a clear, direct way to confirm whether a PFO is present and potentially responsible for a stroke. Always consult with a healthcare professional for personalized assessment and management options.